Our next speakers are going to talk about healthcare issues in China. And first we have Dr. Sun from the Center for Health Management and Policy at Shandong University. I had the privilege of visiting Shandong University a few years ago and was so impressed with the level of their students. I worked with the public health and the nutrition students there, and we had a really good time with them, and I hope they learned some things from the U.S. perspective, but I learned way more from them probably than they learned from me, so I want to thank you for that. Dr. Sun says that in recent days he's thinking of how he can work happier. So I can't wait to hear how he figures that out because we can all share in that. And he also says that if you want to know the culture of China, you must go to Shandong because they are the home of the great philosopher. Some of you may have heard of him, Confucius. Please welcome Dr. Sun.
Good morning, everyone. I'm very glad to be here. And again, it's my third time come here in the past 6 months to the UNF. So because I love this place and love the weather, and also I have met friends in here, so I love this place. And today is an international conference, so I want to select a global topic. I want to select antibiotic resistance as a topic. I want to show what happened in China, especially in the rural area, what happened. So as everyone knows that, I think everyone would agree that the antibiotic is a miracle medicine because it truly has saved millions of lives in the world. But we have to recognize the fact that antibiotics are rapidly losing their effect. Also globally, not only in one country, it's globally. So just why we say that? Because the reason is microbial resistance, because the bacteria have the resistance to the antibiotics. Just like the Fleming said, it is not difficult to make microbe resistant to penicillin. The time may come when penicillin can be bought by anyone in the shops. Now we have see that is happened already in the world. And also now the drug resistance is one of the most serious public health problem in the world. And in 2011, the World Health Day, the WHO announced the global crisis of antibiotic resistance. They said no action today, no clue tomorrow. So now I wanted to use one of my study in Shandong province to show the current situation of antibiotic use and also the resistance in the rural area in China. Irrational use of medicine is a major problem world, and there are a lot of reasons result in the irrational use. For example, overprescription by doctors, access to antibiotic without prescriptions, and also the citizens has limited knowledge on how to use the antibiotics. So, and what's the situation in China now? In China, the situation with respect to the overuse of antibiotic and also resistance is very serious. There are many studies already done in China. It was estimated that in China about 75% of outpatients with seasonal influenza, we call also the common cold, most of them caused by virus, were prescribed by the antibiotics. And also for the inpatient care, the antibiotic utilization rate also was extremely high, around 18%, much higher than that international level of 30%. So this is a basic background of my study. So under this kind of background, we designed a project in the rural area of Shandong province. Why we focus on the rural area? Because in the urban area, we have very strictly regulation. And the providers in the urban area, in the big hospital, they have better knowledge and technology to do with this. But in the rural area, we don't know nothing. We want to know what happened about the rural population, what's their knowledge, attitude, and practice on antibiotic use. And we want to know the behavior of rural healthcare providers, and we want to know the resistance level in the rural area. So basic on this, we designed this kind of project. We randomly selected 3 counties in Shandong province. Shandong province is located in the east part of China, is very near to Beijing. And the Shandong province has around 100 million populations. So it's a very, very big province. And we totally recruited 18 villages in our study. And we use some structured questionnaire to measure the rural residents and healthcare providers' knowledge, attitude, and practice. We call it KP. And also we collected the prescriptions from the county hospital, township health center, and village clinics. This consists of the rural healthcare system. When we talk about the rural healthcare system in China, we usually said it consists of county hospital, township health center, and village clinics. We collected the prescriptions from all the 3 healthcare institutions, and also we collected the rural residents' feces samples to test the ESBL, want to evaluate the antibiotic resistance level. And finally, we totally investigated 1,000 rural population and collected the same number of fecal samples accordingly. So this is the basic situation, and now we can see the result of the study. And we can see, first we can see the prescription analysis result. We totally collected over 10,000 prescriptions from the township health center, county hospital, and village clinics. It should be noticed that, around 40% of the prescriptions with antibiotics. And we can see that the village clinic had the highest percentage among the 3 levels of healthcare institutions. It means in the village clinic, it's just to treat some very simple diseases or symptoms, but they used more antibiotics than that in the county hospital or township health centers. So we continue to see what kind of diseases they treated using antibiotics. We can see most of them, they used the antibiotic to treat the common cold, upper respiratory infection. As everyone knows that most of them are caused by a virus, not the bacteria. But in the rural area, especially in the village clinics, most of antibiotics are used to treat the upper respiratory infection. And also we can see the knowledge, attitude, and behavior of healthcare providers. We use several indicators to measure their KEP. For example, do you know the government, do you know the regulations issued by the different government, and do you know, can you give the prescribe the antibiotic to the patient and their demand or pressures of the patient, such kind of questions? We can see that most of them said, this is a self-reported questionnaire, this is reported by the doctors by themselves, and so most of them said they knew the regulation, and it seems they can follow the regulation. For example, most of them said they didn't prescribe any antibiotic to the patient, even they under the pressure of the patient, under the demand of the patient. They can just depend on the diagnosis rather than the demand of they can insist, they can do the right things, it seems, but we can see what will happen in the later. And here we can see we can see the knowledge of the rural population. We also use several questions to measure their knowledge. I think the key question is about do you know the rule of getting antibiotics with prescription? So this is the key issues when the common people to buy the antibiotic, it should have a prescription. But the result shows that over half of the rural residents in the Shandong province, they don't know. They didn't know the regulation. So this means they have no idea about, if I want to get the antibiotic, I should get the prescription first. They have no idea. They just go to the drugstore maybe and just go to the village clinic to ask the doctor, could you give me an antibiotic to treat such and disease? So this is very key things of the knowledge of the rural population. Now we can see the behavior of the rural residents when they used the antibiotics. We can see that most of them can have a good adherence to the doctor's suggestion. They can follow the advice of doctors and to use antibiotics. But we should notice that about 75% of the patient, they stop to use the antibiotic once the symptom disappeared. I think this is the wrong behavior. So even you have the symptom, for example, the cough disappeared, you should continue to use at least 1 or 2 to 3 days. So otherwise it will maybe cause the resistance happened. So this is the behavior. And also we can see this slide showed the self-reported behavior of doctors and their rural residents to treat the common cold. And we want to compare the self-reported behavior and their real behavior. So when we using the common cold as an example, when we ask the doctors, if you treat the patient with common cold, how will you do? Most of them said, and I will suggest the patient just to go back to home and to have rest, to drink more waters. And so this is good, this is right. But when we analyzed the prescriptions, we found among the prescription diagnosed as the common cold, generally over half of them had the antibiotics. And the village clinic had the highest percentage. So there is a big gap between the self-reported behavior and their truly prescription behavior of the rural doctors. So this is a very interesting result. We have to ask why. It seems the doctors had very good knowledge about the antibiotic. They also knew the regulation of antibiotic use. But why? In the practice, they use too much medicines. So this is one thing we have to discuss. So this is related to the public health reform, related to the incentive mechanism, a lot of reasons. I don't want to take more about that, but it's very, very interesting. And now we can see the ESBL. The ESBL, does anyone know the ESBL? Oh, it's good, because I don't know also. ESBL is a microbiological term, I think. It's an enzyme. Enzyme means we use the ESBL. If we test the ESBL in the samples, means the bacteria had the resistance to some kind of antibiotics, especially for the 3 generation of cefamycin. It's very popular used antibiotics in China, especially in the rural area. Yeah, we can say that among the 1,000 rural residents in the 3 counties, the average ESBL rate is 42%. It's extremely high. You know, at the beginning, when we designed the studies, we estimated it around 10 to 20 at all. We use the percentage to estimate how many samples we should collect. When we estimate 10 or 20, but finally we found the rate is around 42. And you can also see the big variation among the different counties and also the different villages, from the 27% to the 50%. So there is a big variation. And also this is showed the distribution of the variation of the ESBL rate in the total 18 villages. From the lowest is only 21%, but the highest is nearly 70%. So it's very, very serious, seriously problem now in the rural area. So I just want to give you a very quick conclusion about our research. And we can see the rural antibiotic use showed a very high proportion and also high resistance rate. And the main disease of use antibiotics to treat is the common cold. And the village clinic was the most serious abuse of antibiotics. And we should find a very effective way to improve the doctors and the residents' knowledge on antibiotics. And also, the doctor's antibiotic prescribing behavior was inconsistent with the self-reported behavior and the truly prescribed behavior. We should pay more attention about that. So this is a basic conclusion from our study. You know, this study was conducted in 2013. After that, we knew the worst situation of antibiotics in the rural area in China. So we continue our research. We collaborated with some universities from China, also from the world, mainly from the Sweden. Because the Sweden government signed agreement with Chinese government to fight against the antibiotic resistance together. And so we designed another project. We called it IMPACT. It's an integrated multi-sectoral research project. In this project, we don't only see the antibiotic use and resistance in human. We also want to know what happened in the animals, especially for the feed animals, and what happened in the environment. And we also want to know the relationship among the human, animal, and the environment. We want to set up a cooperative mechanism to fight against antibiotic together. Now, for this current project, we have finished the baseline survey already. So this picture is showed after we done in the county, and we have a collective picture to celebrate it. So I just want to use several, maybe 1 or 2 minutes, just to introduce my unit. And just what I said, I'm from the Shandong University, and this is Center Health, and also from the Center for Health Management and Policy. And the center is also the only one key center for health economic and policy research managed by the Ministry of Health. This is our website and also my email. So this center is research-based, and we conducted a lot of research on the health economics, health policy, and health service study. And we also pay a lot of attention on some global issues, such as just what I said, antibiotic issues. And also we paid a lot of attention on the tuberculosis control. So it's also a very big problem in the world, also in China. And also we also run several master and PhD degrees on health science and health management or health economics. Now we had a new master degree of hospital administration. Now this is what we are collaborating with the UNF, and so this is why I come here so frequently, and so we are working on that, and how can we set up the collaboration to train our students on the hospital-related administration issues. So this is just I just showed a picture. This is the main gate of our campus. and you can say it's very old. It's over maybe around 120 years old. I'm not sure. Maybe this is just to make it of our campus, and not so big, but it's very. I think it's very beautiful. A lot of them have been there. So finally, I want to say some collaboration. I always believe that, and in this current world, cooperation is the key to success. I really hope, and in the future, anyone want to do some research related, or also want to go to the China and to do some global issues, we can welcome to the school, welcome to China. Thank you very much. Hello.
I wonder if you think that more attention should be paid to public education on the question of antibiotic resistance. If someone has a common cold and they go to a doctor to get treated, the doctor says go back and drink liquids and have a good rest, they'll go to another doctor because they want some medicine. And the easiest thing for the doctor to give them is the antibiotic. I see that here in this country. I've got personal experience with my family. They expect to get treated with something. And if a doctor has got some backup, public campaigns where people become aware of the fact that antibiotics are not what you take for a common cold, they would be more inclined, I think, to give them a correct diagnosis and refrain from giving them.
Yeah.
Do you feel that way?
Yeah, I totally agree with that. So public education is very important. Truly, we also did an intervention project. After that, we focus on the caregivers in the rural area. We want to educate the parents and to improve their knowledge about that. We want to educate the parents to not use much antibiotics for their children. But you know, it's for the education, it will take time to see the effect. So this is the problem. And about what you said, if the patient look to another doctor, maybe they can give. So this is situation, right? So just what I said is incentive mechanism. If you give the patient with some medicine, you can get the belief of the patient. The patient will believe you, and you can also get many benefits, maybe economic benefits. So this is why. So it's it's a lot complicated. It seems a very simple questions about antibiotics, but we have to design a comprehensive intervention, not only for the public education, and we also want to change some incentive mechanism. So this is what I'm working on yesterday night, another new project for this.
I'm just curious. I'm a nurse and I deal with dealt with a lot of patients with MRSA. I was wondering if China has developed any or is doing any research on vaccines for MRSA prevention.
Yeah.
Just a quick question. Excellent research, Dr. Sun. Wanted to ask about the policy, the health policy within China. Do the physicians receive an incentive or a disincentive for overprescribing prescriptions? There may be an incentive from the private sector or a disincentive from the government for their prescribing habits.
So it's hard to explain that. Maybe some places have the incentive, but sometimes it's culture issues, I think. The Chinese herb is very popular. Very popular. Everyone want to go to the hospital, they want to take medicine. If the doctor just give you some advice, they didn't just give you any medicine, the patient will complain about it. So not some incentive, maybe some the culture issues. Yeah.
Our next speaker is Dr. Bian, and he is from the Institute of Chinese Medical Sciences at the University of Macau. And when we asked him to tell us something about himself, he said that he doesn't like casinos. And I understand that there are a lot of casinos in Macau. but he likes to research casino game rule very much. I think that means you like to play in the casino. He also says that Chinese food is spreading around the world, and he eats all around the world, but he says Chinese food around the world is quite different from the food in China. And he says if you want to eat pure Chinese food, the only way to do that is to go to China.
Good morning, everyone. I'm from China. From China, SAR, a special administration region, Macau. So, because maybe you heard about Macau, this city, 20 or 30 years ago, Macau is a so-called the Eastern Las Vegas. But today, Las Vegas is the so-called the Western Macau. So it's a chain. Gambling and casino in Macau is famous. Okay. I'm not care about casino. I care about essential medicine. So my presentation is about essential medicine. Sorry. Okay. My study is an effective study of national essential medicine system in China. This is an empirical study from the rural PHC, Primary Healthcare Center in China, 4 provinces. Okay, this is about the outline, background, objectives, method, and the result discussion. For the first section about background, from 1977, WHO has issued about the basic conception of essential medicine. And also this very important concept, not only WHO, but also in the world developing countries, especially China. So the essential medicine must be the quality, safety, efficiency, and public health beliefs, and also cost effectiveness of drugs. So in China, why this is a very important issue for the health policy? Because from 1979, the China central government to issue about the first version of essential medicine. But the following each year, there are some other Ministry of Health, Ministry of Security, Ministry of Science and Technology issued a different version of essential medicine. So because of the health insurance is not complete in the national level, so the different version conflicts each other. So from the March of 2009, the national government of China began to launch a new round of healthcare reform. So this is a very a big project, a very big scale in China. So I take part in one of the research is an essential medicine system. So, okay, this essential medicine must be making essential medicine available and also control the drug cost. So yesterday, Taylor, we talked about this China. It's a huge market, 40 billion Chinese dollar each year. This is the drug market, and also reduce the irrational medicine use. So Dr. Sun just talked about this medicine use in China rural area. Okay. So this project question, research question is focused on the 2 sections. The one is whether and to what extent does the new essential medicine system achieve its original objectives. Number 2 is what are the factors that affect implementation of new essential medicines. Objectives, number 1 is to evaluate its impact on medicine price and affordability. Number 2 is assessment its effect to improve medicine use. Number 3, to analysis its impact on the operation of a PHC. Number 4, investigate the social awareness and satisfaction. We investigate medical doctor and patients. Method, okay. The design of this project is a pre- and post-reform comparative study. The data was collected from 2009 to 2012, but this analysis only analysis from 2009 to 2011 because the list changed. The drug list changed in the year of 2012. So, okay. This data results, the map of China. So you can see the Shandong and Anhui and Zhejiang and also the western part, Ningxia provinces. Include the questionnaire survey and prescription review, document review, and the key informant interview. So totally we have 146 PHC in the 4 provinces. Data collection include the questionnaire, and questionnaire 1 is a medicine price from all of the PHC, and also the general information of the PHC, for example, the hospital size, number of patients, and the number of income, expenditure, and also medicine delivery. And also the questionnaire 3 and 4 is social feedback. Social feedback is from the patient and the doctor. Okay, so this is about this general number about from the different provinces. PHC, the number, prescription, the number in different years. Okay, so we use the method to calculate this price index by the loss index because this morning the presentation, short time, I cannot explain the more detail about the loss index and the pass index. So it means to fix the basket of good and also to fix with the changing of basket of good, the 2 methods to calculate the index. Okay, so how to calculate the affordability? Because we, all of us, to common use, about one method is a WHO-HAI. WHO-HAI is a Health Action International. The method is a MPR, median price ratio. So it's compare with the cost of medicine with average day income. So the patient. So we know to purchase. According to the World Bank, in 2010, the average PPP is about 4.2, and customer CPI in 2010 is 3.3%. This because of this number is from China Central Government Statistic Department. And also we use national relative poverty and also per capita income for the rural household side interview. Okay, and another use for the medicine, rational use. For this study, I want to talk a little bit more. Rational use is a very difficult aspect to measure because different country, we have a different clinical treatment way. So this we to introduce about WHO INRUD method is international network of rational use of drug. So you can find this method and detailed information from the WHO website. Okay. So we explore the agreement of a hospital presentation about this policy for policy experimental study. This we also wanted to find which impact factor are the main factors. So we use about this independent variable and dependent variable to do the regression analysis. Okay, the result number 1, individual price difference. So generally, before and after the healthcare reform, the price of the drug decreased. The drug price was 34% lower than the before of the healthcare reform implementation. And the quantity of drug usage was increased about 1.5%, a little, very little, it's very little. So for the PHC decrease drug sale 39% on the average. And also, the version of 2009, there were totally 307 drug list, essential drug list. For this drug list, about 205 WM is Western medicine, and also 102 TCM, traditional Chinese medicine. So this is very special. This is very special. TCM is very popular with a long history in China healthcare system. Okay, so this number are from Shandong province and Ningxia. It's a decrease about the price is a decrease about 40%. 40%. This is a very interesting result because if the loss index smaller than 100%, the pass index is larger than the loss index. So this result, what means? How to explain this means? It means the essential medicine in China, the price is very, very sensitive index because this is the price, this is the amount of seller. The price change a little bit, a little price 1%. The sale amount will be increased a huge number. Yes, so this is so why we study the price, drug price in China, because it's a sensitive index, and also it's not the impact of the patient healthcare, but also the drug market in China. So this is interesting. Another one is MPR, median price ratio. So from here you can see today the cost of a patient to buy the drug is about 8 days, more than 8 days average income. And before this healthcare reform, it's 13 days, about 14 days. So this is means the burden. This burden, the drug burden, after the healthcare reform is decreased. It's decreased. But if you compare with the international average level, it's so high. It's so high. So WHO in the year of 2010 to issue the result, the average in the world is 3.5 days average income. So it's a big, very big drug cost burden for Chinese patient. So this we analysis a different area because the China is a so big country. Economic state between the east part and the west part is quite a difference. So the low income and the middle income, they say that the number changing. It's I think the trend is good. The trend is good, but the result is not as good as we originally expected. So this about little remarks. Result number 2 is to improve how about the effect to improving the rational use of drug. Okay, so this is about the general number. Number of drug prescription per encounter, and the percentage of encounter with antibiotic, and also something so on. So we can say is the number, the result indicated the situation is get a little bit better before the healthcare reform. Yes. So okay, we analysis the further. Research is the all the indicator will be analysis from 2009, 2012, and 2015, because every 3 years the essential medicine list change. It's not a trend, it's a justification. Because some drug is not effect and a new technology emerged. So this we are going on for this index. Medicine cost per patient visit, you can see from here, you can see it's an increase. It's increase. Even the drug price are going down, but the cost per patient is also increase. So this is why the disease burden in China is so heavy, particularly for the rural farmer. So, okay. Result number three is about the operation, particularly of the economy, operation of PHC. This number, national essential drug, and also we have a promise essential drug. So this is the NED and the PED. This is a quite long story, so I think the time limitation, I cannot to tell about the detail. Okay, so from here you can understand about in the different years from 2009 and 10 and 11 economy situation of essential medicine is about okay. I think it's just okay. Not as good as we original design of this healthcare reform. Okay, and this is the average efficiency of medical delivery because before the healthcare reform is issued by the province government or even the central government. So this the process is a decentralization. You can find this going down. Response rate of delivery is going down. Okay, the number of patient visit in the PHC, rural PHC, is going up. The red line is inpatient. The black line is outpatient. In the different years, the income and the cost of a PHC. The income is going up. So this essential medicine system not increase the PHC revenue, but impact of this balance, impacted the balance because the money is going down, revenue is going down. Okay, so we have analysis of this forecasting about if the simulation without the policy intervention. So what means with policy intervention and without the policy intervention? Because in China, normally, basically, every hospital, even included the PHC, we have a 15% profit. So what means 15% profit? If the hospital to buy the drug $100, you can sell at least $115. So this is a very important drug policy in China. This is from the central government to the provincial government and to the local government. So everybody, just another professor talk about this is induced. This is the induced drug use. So we analysis of so the different curve is means if the 15% bonus going down 9%, 7%, 5%, or 3%, what will happen in the future years? So this is the curve about this means okay, different model. Okay, so this the curve number 1, 2, 3, 4, 5, 6, 7 is means different level from 15%, 10%, 9%, 7%, 2%. Because from last year, they have the China government have a part of the study This is just a pilot study in 16 city to cancel this profit. It's a zero profit. So what's happened? We don't know. It's from last year. We keep on interesting for this point to find out this maybe very interesting result. Okay. We also to do the survey about the awareness. Patient, yes, okay, this is the patient and the PhD doctor. So basically, normally we find the PhD doctor understand and to use essential medicine, but the patient and local resident, they don't understand what means essential medicine. No idea. So this is quite different because in the rural area, the people, Chinese people, the education level is poor. I think is poor. It's very poor, especially in the western part of China. So they don't understand what means essential medicine. So are you satisfied with essential medicine? No. What means essential medicine? I don't know. So there's a gap, a very big gap. So this we to do the satisfaction by the regression analysis. You can find this. Okay. Final one is a discussion. There are some PowerPoint you can. Okay. The discussion I want to do talk about two issues. The one is essential medicine list to change every 3 years. 2009 is 307. In the year of 2012, it's 500. Last year, the new version, the renewed version is 497. So the number of essential medicine compared with another Chinese society, Taiwan. I'm from China. Taiwan is a part of China, okay? Because from the beginning of 1999, the Taiwan Health for All insurance included 2,400 essential medicine. So I think compared with another Chinese society, we only have about 500 essential medicine list. It's too few. It's not can provide of the drug services for the people. Okay, so this is I want to talk about the one issue for discussion. Number two is the drug sale in the China society, particularly in the rural area. There's a very big profit, even zero profit. There are some, Chinese people to do some under-table trade. So you cannot control of this very sensitive drug price. So I think the drug price should be transparency in the future. China pharmaceutical industry and also pharmaceutical hospital and also the newspaper and the media. So this my comments, two comments, I think is the most important. Okay. Conclusion number one. The new essential medicine has its intended impact of the drug price, control the drug price. And also the comprehensive approach of China essential medicine could be a good example for the WHO essential medicine concept. And also the remaining challenge for individual problem in policy design and implementation will be studied. My team and also my students also research focus on this area. Okay, this policy recommendation, yes. So we have from 2014, before last year, and this year we have 6 SCI paper and 62 Chinese peer review paper published. So if you interested about the detailed information, you can find the full paper from Web of Science. Acknowledgement. This is supported by Macau Foundation and also my university. And another very powerful ministry in China's central government is National Development and Reform Commission, NDRC. Very powerful ministry in China. They give this research grant for support this study. Thank you. Yes.
Excellent study. Wanted to know, how does the Chinese government enforce the essential medicine list? What policy is there for enforcement?
From the very beginning, 2009, this is the original design for the Chinese central government. So first step, PHC included the rural area and also the urban area must to use essential medicine at least 8%. So because China, we have a very tough statistic system from local to the city to the province to the central government. You must to use at least 8% essential medicine. From the year of 2013, the county level, this is the international language, is a secondary hospital level. It's must to use at least half the use of the drug is essential medicine. So because the essential medicine, so you compare, another very interesting information is you compare with essential medicine price and non-essential medicine price is a big gap. It's a big gap. So this is why the central government to issue this policy. You must to use how many percent of the essential medicine in the different level health statistic. Yes. Thank you. Yes.
Have you noticed any additional strain ever since China lifted the ban for the one child per family policy?
Oh yes. Yes. This is a big, very big topic. What do you want to know?
So, is your research looking into that, or is the healthcare system doing anything drastic to compensate for all the extra population?
One child policy with this drug?
Yes.
No. Because last night, I remember we talked about one child policy. This policy is how to say, is open, is a break, is a change, because the manpower, the China manpower, is going down. So 2 years ago, in Shanghai, big city in China, this policy open. If you open, it's not means you. It's not means you want to have a 3 child, 4 child. No, only the second. Only the second. So from last year, this opened in the whole country. If you want to have the second child, okay, yes, it's okay. But essential medicine is not care about how many children you have. No, because the health essential medicine only controlled by the health insurance scheme. Yes. So if your family, your children to buy this healthcare insurance reimbursement by this rule. If you buy another health insurance reimbursement by another rule, it's not relationship with one child or two or an else. Okay.